On February 19th, the World Health Organization issued a clarification. It said that it has not reviewed or certified the effectiveness of any traditional medicine for the treatment of COVID-19. But why exactly is this clarification being issued? And what's the traditional medicine that the WHO is referring to? On February 19th, Baba Ramdev, the founder of Patanjali Ayurved, announced that a team from the WHO had visited his company and given Coronil, his company's purported cure for COVID-19, the license that makes it eligible for sale in more than 150 countries.
WHO के जो है पूरे के पूरे एक टीम आई हमारे और उसने 150 से ज़्यादा देशों में हमने अब कोरोनिल से लेकर के 100 से ज़्यादा जो हमारी गिलोय घनवटी से लेकर आंवला एलोवेरा से लेकर के तमाम तरह के च्यवनप्राश से लेकर के वो प्रोडक्ट जो हम यहाँ पर साइंटिफिक रिसर्च और एविडेंस के साथ बनाते हैं उनकी परमिशन दे दी है.
Rakesh Mittal, one of the top executives at the company, went on to claim that the WHO had recognized Coronil as the first evidence-based medicine for COVID-19. To make matters worse, a launch event took place on the same day, which was attended by Road Transport and Highways Minister Nitin Gadkari and Health Minister Harsh Vardhan. A large poster in the background of the event claimed that the purported medicine was COPP and WHO GMP certified, essentially meaning that Coronil was recognized according to the World Health Organization's good manufacturing practices and that it holds a certificate of pharmaceutical product. However, after the WHO clarification was released, Patanjali CEO Acharya Balakrishna tweeted, "We want to clarify, to avoid confusion, that our WHO GMP compliant COPP certificate to Coronil is issued by DCGI Government of India." Embarrassing? It is. But more than that, it's another attempt at fostering an ecosystem of pseudoscience that's not only pushed by Patanjali, but by the Health Ministry itself. In March 2020, Prince Charles, heir to the British throne, was recovering from COVID-19. But the celebrations of his recovery were taking place thousands of miles away in India. And not only that, the credit for his recovery was being taken by Union Minister of State for Ayush, Shripad Nayak, who claimed that the prince recovered under a treatment of Ayurveda and homeopathy. In response, the British government released a statement saying that the information was incorrect and that Charles recovered under medical advice of the NHS in the UK and nothing more. For the Ayush Ministry to make these sort of claims isn't new. In fact, during the early stages of the pandemic last year, the ministry suggested a number of treatments for COVID-19. It included a homeopathic medicine Arsenicum album 30, which contains extremely diluted arsenic. The ministry recommended this as a prophylactic for COVID-19, meaning that it was a medicine that would prevent the disease from happening. And while there was no evidence on whether the medicine had any properties of preventing COVID-19, the sales of it skyrocketed. On May 18, 2020, Mumbai reported over 35,000 cases and more than 1,200 deaths due to COVID-19. In the same week, members of the ruling BJP distributed 10,000 bottles of Arsenicum album 30. That's not all. In October, the Ayush Ministry released recommendations to integrate Ayurveda and yoga interventions into India's National Clinical Management Protocol for COVID-19. One of the recommendations that it made was that patients should take an Ayurvedic formulation called Ayush 64. According to a report by India Spent, the 4 plant extracts present in this formulation haven't had human trials conducted yet and could even prove to be harmful. When the Ayush Ministry itself allows and promotes the sale and distribution of such purported medicines or claims that a certain public figure has been cured of COVID-19 by the methods of medicine the ministry suggests, does it really come as a surprise when a private company providing a similar method of treatment dubiously claims that it has created the first evidence-based medicine for COVID-19, no less certified by the WHO? At this point of time, the Ayush Ministry has recognized Patanjali's Coronil as a medicine for supporting the measure in COVID-19. All of this is happening at a time when there is a surge of COVID-19 cases in several parts of India. M.K. Venu, a founding editor of The Wire, highlights how the private sector's involvement could allow scaling up the vaccinations and how the vaccine diplomacy is playing out at a time when cases are going up in the country.
So Azim Premji, who's a leading voice in Indian industry and also a philanthropist, he made a suggestion to Finance Minister Nirmala Sitharaman in a post-budget event where he said that India has to scale up its vaccination, and he says it is possible to scale up 500 million up to 500 million vaccinations in 60 days, within 2 months. And he said that this could be done with by involving the private sector. Now, my feeling is that what Premji said makes eminent sense, because we all recall how even the testing initially when COVID happened, private sector it's only when private sector got involved in testing, all the healthcare private sector units, that we actually saw a big scale up in the testing across different states. So it's in India, healthcare government spends very little in healthcare, and we all know that in India the private sector plays a big role in healthcare. Now, if there is apprehension that the private sector might make money out of this vaccination, then the government is free to put a ceiling on the like they did in the case of testing, right? 750 rupees per test. So by all means, put a ceiling on the charges. But the idea is, please involve the private sector, as Azim Premji says. It is critical to involve the private sector because, as I have pointed out, Maharashtra is seeing a big surge in COVID cases. Pune city is seeing a big surge. And ironically, Pune city is seeing a big surge at a time when Serum Institute, which has manufactured and stockpiled Covishield vaccine, is sitting on some 60-70 million vaccines stockpile, waiting for the government, waiting for essentially Prime Minister's office to give them a green signal for either offtake by the government or for commercial delivery. And in the last 1 week, I have been watching TV channels where healthcare specialists, doctors, senior doctors, Naresh Trehan, Guleria, AIMS, head of AIMS, they're, Kiran Majumdar-Shaw, they're all saying that the private sector must be involved immediately. We cannot afford to lose time. That's what the point I'm making is, if you lose time, then you might have a second wave, third wave, and there could be another shutdown. Even if it's partial shutdown, it's the poor who will suffer again. India's fiscal stimulus, cash stimulus, has been very, very minimal, and the only guarantee that we have to protect the workers from who've come back to work from going into another lockdown and losing their incomes is to vaccinate them. So this has a great economic implication. That's my limited point. And the other point is Premji's advice to Sitaraman. The entire budget, India's budget, is predicated on a certain confidence that the economy will be back and people will be vaccinated, workers will start coming back to factories, and demand will be generated, incomes will improve. Now, if that doesn't happen, I'm sorry to say that even the budget could just sort of go out of the window. If 3-4 large states, economically significant states, if there is a resurgence, then I shudder to think what will happen to the economy, what will happen to the incomes of the working class, because the rich has protected its wealth in the last. That's what we have seen the last 12 months, and that's what Oxfam report says. Right? It's the poor and the lower middle class incomes which have suffered. So I think vaccination is directly linked to the incomes of the lower middle class. Everybody is asking this question: if you are selling, if you are allowing commercial export of vaccines to other countries, why can't we simultaneously have commercial sale of vaccines in our domestic market? It's a very simple, logical, rational question. Why can't it be simultaneous? Why are we exporting first and then waiting for not taking a decision? Now this is for the government to start delivering vaccines locally. In fact, in this context, Naushad Forbes, the former chairman of CII, who's also Pune based, he runs a company, he's the owner of a company. He says the rate at which we are vaccinating now, which is about 1 crore in 1.5 months. In this year, so far we've done 1 crore vaccinations. We will be able to vaccinate our whole population only in 17 years. Now, this is the the sorry at tardy pace at which we are vaccinating. And there's obviously lack of coordination. There is no decision making. So, but exports are happening. Now, I don't see any other country which is focusing on exports at the cost of their domestic constituency. China is doing a much scaling up in a much faster way and vaccinating its population, which is comparable to our size. Other countries are also focusing on the domestic because you have to get your people back into regular economic activity. And I would just add one more thing here. The worst affected in Indian economy is the service sector. Our service sector provides employment to 60% of our total employed are in, the service sector. And service sector is the worst hit. And people have not gotten back to work fully in the service sector. Tourism, hotels, restaurants, etc., public places where there is contact, the construction. We need to get our service sector back and get people's incomes also, restored. As I said, for that reason, I think we have to prioritize vaccination to the domestic sector before exporting on such a big scale in the name of diplomacy. Or they can happen simultaneously. I'm not saying one or the other. It's not an either or choice. So I think that's the way we should go about it.